Hi dear medicos, welcome to Medical Students Corner. Today is Sunday and today is our ECG day. So as I have promised in the last ECG session, today we are going to discuss about the cardiac cycle. So what is cardiac cycle? So the succession of synchronized coordinated events taking place during every heartbeat is known as cardiac cycle, and the time taken for each cardiac cycle is 0.8 seconds. 0.8 seconds. So both systole and diastole is taking place during every heartbeat. We will see the steps steps involved in cardiac cycle. So this we will be shortening the session and we will be saying only the important points. Okay. So the first step of cardiac cycle, first is atrial systole. Atrial systole. So this is the first step of cardiac cycle. This atrial systole, it is also known as pre-systole of ventricle. Okay, pre-systole. So in atrial systole, what happens is, suppose this is heart. Okay, this is heart. This is atrioventricular valves. You think like that. Okay, this is atrioventricular valves and this is semilunar valves. From this the blood vessels arises. Semilunar valves. Okay, so in case of this atrial systole, what happens is 10% of blood from the atrium is flowing towards the ventricle. So 10% of blood from the atrium is flowing towards the ventricle. Okay, this marks the pre-systole of the ventricle. 10% of blood from the atrium is flowing towards the ventricle in case of atrial systole. You understand? And the time taken for atrial systole is 0.11 second. 0.11 second. Next, the second step is isometric contraction. Isometric contraction. So what iso means all, contraction. So both the ventricles is going for contraction period now. So here what happens is, in isometric contraction phase, this is heart, this is atrioventricular valve and this is semilunar valve. What happens is, now all the blood from the atria came towards the ventricle. Is it not flown to the ventricle? So what happens is, there will be more amount of blood in the ventricle and the pressure in the ventricle is increased. And in case of isometric contraction, all the valves of the heart, that is both atrioventricular valves and both semilunar valves, are closed. Okay, and the time taken for this isometric contraction period is 0.05 second. Understand? This is the second step of cardiac cycle. So first is atrial systole, second is isometric contraction period. Okay, next, third step is ejection period. Ejection period. So now what happens in this ejection period is, now the pressure in the ventricle is increased. Is it not? So what happens is, because of in the isometric contraction period, all the valves are closed and the pressure in the ventricle is more. What happens is, this isometric, the significance of this isometric contraction period is, because of this increased pressure in the ventricle, what happens is, these semilunar valves get opened. You understand? So semilunar valves get opened. So we will again draw for better understanding. This is heart. So this is atrioventricular valves. This is semilunar valves. Semilunar valves. So what happens is, in case of ejection period, what happens is the atrioventricular valves get opened. Okay, get open, and what happens is blood from the ventricle flows towards the blood vessels. Blood from the ejection means this blood in the ventricles will be ejected towards the blood vessels in case of ejection period. There are two components in ejection period. One is rapid ejection and other is slow ejection. Rapid ejection is the first stage where more 70% of blood is ejected towards the blood vessels, and in case of slow ejection remaining 30% will be ejected, and the time taken for this ejection period is 0.22 second. You understand? So these are the first 3 steps. You understand? Next, so you understand? If you are having any doubt, you can comment in the comment box. We will discuss again. Okay, so these are the first 3 steps. Next step is protodiastole. Diastole, and this lasts for 0.04 second. Here what happens is, in this protodiastole, what happens is, now all the blood from the ventricle is flown towards the blood vessel, is it not? So what happens? The pressure in the blood vessels is more than that of the ventricles. So because of that pressure, now in the ejection period the semilunar valves is opened, is it not, in order to eject the blood towards the blood vessels. But in case of protodiastole, these semilunar valves become closed. You understand? Now all the valves are closed. So atrial systole, isometric contraction, ejection period, and protodiastole. Next, 5th is isometric relaxation phase. Now the ventricle is not having any blood, is it not? It is ejected and the ventricle is in protodiastole state. So in isometric relaxation phase, what happens is, all the valves of the heart is closed. All the valves of the heart is closed, and also the ventricle is ready for receiving the blood, is it not? Now ventricle is free and the ventricle is now ready for receiving the blood. The significance is that when the pressure in the ventricle is reduced, and what happens is, in order to receive the blood in the isometric relaxation phase, the atrioventricular valves get opened. Understand? Atrioventricular valves get opened. This is the significance of isometric relaxation phase, and the time limit of isometric relaxation phase is 0.08 seconds. 0.08 second. Next step is rapid filling. So in case of rapid filling, what happens is, so you guess what will happen in case of rapid filling? Now the ventricle is free, it is ready to receive the blood from the atria, is it not? So in case of rapid filling, what happens is, the atrioventricular valves open. And the blood from the atria is flown towards the ventricle. 70% of blood from the atria is flown towards the ventricle in case of rapid filling. And the time limit for this rapid filling is 0.11 second. Rapid filling is 0.11 second. Next step is slow filling. So, this marks the end of rapid filling, and in case of slow filling, what happens is 20% of blood which is in the atria will be flown towards the ventricle. Okay, 20% of blood in the atria will be flown towards the ventricle, and the time taken for this is, again there is flow, and the time taken for this is 0.19 second. You understand? So, this is the 7th step. So, first is atrial systole, isometric contraction, ejection period, protodiastole, isometric relaxation, rapid filling, slow filling, followed by atrial systole. So, these are the 7 steps which marks the cardiac cycle. So, this is a cyclical event, is it not? Like this, it is happening during every heartbeat. So, this is like a cycle, it repeats again and again. So, it is known as cardiac cycle. So, cardiac cycle is very important for understanding the function, normal function of the heart. It includes both atrial systole, ventricular systole, atrial diastole and ventricular diastole. But the thing is, the atrial diastole is not mentioned here because it is in conjunction with the last stage of ventricular systole and the first stage of ventricular diastole. You understand? So, you add all these seconds and it will give you 0.8 seconds. So, cardiac cycle, it takes place, the time taken is 0.8 seconds. The importance of cardiac cycle in case of ECG is, ECG monitors the ECG waves, monitors the different steps in the cardiac cycle, that is atrial depolarization, ventricular depolarization, atrial repolarization, ventricular repolarization, like that. If you are understanding the cardiac cycle only, then you can understand the ECG. You understand? So, we will conclude today's session. Hope you have understand. Hope you have enjoyed the session. If you are having any doubt, please let me know in the comment box. We will discuss again. If you need more discussion, sure, we will discuss in our channel again. Thank you for listening. Please subscribe. Please share to your friends. Happy learning. Thank you so much.